Our government continues to be very committed to the commissioning of the hospital, the St. Jude Hospital, at the Auger site. This year, in the estimates of revenue and expenditure, the Prime Minister, Minister for Finance, allocated even more funds, more resources to ensure that the commissioning process takes place, to ensure that the commissioning process is complete, and to ensure that the people of the South and the people of St. Lucia get the St. Jude Hospital at Auger. Well, we're very happy that a few of the departments have moved. For example, the physiotherapy department has moved, and the clients are visiting the physiotherapy department, and our professionals are giving service at the physiotherapy department. We know that administrative services have also moved, and the kitchen has moved, and we know that in the next few days the kitchen will be in use. The laundry services have also moved, and we are very happy that equipment continues to arrive at the St. Jude Hospital and be installed. We are now in the process of verifying the equipment to ensure that every piece of equipment is fit for purpose, and professionals, both professionals from St. Lucia and professionals from overseas, from the source markets, where the equipment is coming from, professionals are in St. Lucia to ensure that the equipment is fit for purpose. So we are very pleased that the installation of equipment, the movement of departments, all of that is happening, and we are hoping that the full commissioning is coming soon. Well, already the residents of the South are experiencing a new level of service delivery in the physiotherapy department, for example. Hundreds of St. Lucians have received service at the physiotherapy department, and the other departments, like some aspects of management, the administrative services, are already operating from the Auger site. We expect expanded services to the people of the South and to the people of St. Lucia. We expect a higher level of service, especially since we have new equipment, high-tech equipment, modern equipment, and we have had training and orientation for staff to operate that equipment. So we expect, as a result of this new equipment and the new training and so on, that the people of the South and the people of St. Lucia will receive a higher level of service, higher quality services. We also expect, as I said before, expanded services. We see, for example, our dialysis department, we are going to have additional dialysis machines. We note that in the radiology department, we will see improvements there in radiology. And we are hoping to bring on board other clinical services to serve the people of St. Lucia. So I'm very excited about the new St. Jude Hospital and the possibilities for new services, a higher level of service delivery, and really a hospital which will make us proud. Well, as you know, this government has always focused on universal health coverage. We want to provide services to the whole of St. Lucia. We want to increase access to health services. We want to ensure that access to health services would not come as an increased financial burden for our people. And we want to ensure that the quality of health services is improved. So the addition of the new St. Jude Hospital will assist the government and the people of St. Lucia in that regard, because you are going to have additional services, expanded services in the South, at a hospital in the South, and we are going to see new equipment, training, of the staff to handle new equipment and provide new and expanded services, and therefore it assists the government in its quest to advance universal health coverage all around, to give St. Lucians, right around St. Lucia, access to high quality services. We anticipate within 3 to 4 months the full commissioning will take place. We know that a number of teams have been put together. We know teams have been mobilized at the local level. We know we are collaborating with professionals from outside of St. Lucia who are helping us with the commissioning. We are ensuring that the equipment is being tested. We are ensuring that the onboarding of various services, various teams, that the orientation is taking place. We are ensuring, for example, that we move even faster with digitization of health records, so our processes can be more efficient. So yes, we are hoping within 3 to 4 months we can have the complete commissioning of the St. Jude Hospital, and I'm looking forward. I'm sure the people of St. Lucia, the people of the South in particular, are looking forward to that commissioning. Well, firstly, we were handed, that is the Ministry of Health, Wellness and Nutrition. That ministry was handed a hospital which was completely refurbished, a new hospital, and the construction of the hospital. We are proud of the way in which the hospital was reconstructed. Secondly, we are pleased with the way the commissioning team has done its work. The commissioning team is fully on board, and they are working day in, day and night to ensure that all of the processes take place, to ensure that the onboarding of various departments take place in an organized way. We are doing the training. The commissioning team is spearheading training of our technical teams, training of the workers at St. Jude, the various departments, to move into the hospital. If you look at the public pronouncements and also the video in the St. Lucian media, you will see various teams visiting the hospital to ensure there is familiarity with the site, and we are ensuring that we put additional resources, financial resources, into the St. Jude Hospital. In the estimates of revenue and expenditure, the St. Jude Hospital was again given additional resources so that the management of the St. Jude Hospital can ensure that the procurement of pharmaceuticals and other equipment is done. So the government is preparing, and we have been preparing for a while, and we are hoping that when the hospital is fully commissioned, the people of St. Lucia, we are looking forward to the people of St. Lucia seeing all of these services being put to full use.